Hello everyone, my name is Ajay Vinjamuri, and today I'll be presenting on applying deep learning to diagnose Alzheimer's disease. This is an overview of what will be covered during this presentation. I am a rising junior at Rockridge High School and an incoming public health researcher for a lab at Harvard Medical School. Some of my interests include politics, especially at a local or state level, and research, whether independently or with a larger group. And today we will be talking about a few common methods to diagnose Alzheimer's disease and how deep learning may help. According to the National Institute on Aging, Alzheimer's disease is a brain disorder that is characterized by the slow degradation of memory and thinking skills, eventually rendering its victims unable to accomplish basic tasks. It is generally attributed to an increase in a protein called beta amyloid in plaques, inhibiting neurotransmission and communication, and this is formed from a general breakdown of a larger protein called an amyloid precursor. Alzheimer's disease is also attributed to the buildup of abnormal tau tangles within neurons. In healthy neurons, tau binds and helps stabilize microtubules, supporting the neuron structure. Unfortunately, in Alzheimer's disease, abnormal chemical changes cause tau to detach from microtubules and form large tangles with other tau proteins, possibly inhibiting communication as well. Now, regarding stages of Alzheimer's disease, there's a lot of contention between how and when certain stages of this disease occur. Some believe in 5 stages, while others may believe in more or even fewer stages. This is an example of the three-stage model of Alzheimer's disease, separating Alzheimer's into three main stages: early, middle, and late stages. This may also be referred to as the mild, moderate, and severe stages of Alzheimer's disease. The main symptoms of Alzheimer's disease include memory loss, speech or language difficulties, and the inability to carry out everyday or simple tasks, which become much worse as the victim progresses through the multiple stages of Alzheimer's disease. However, in the early stages, it is very difficult to diagnose Alzheimer's as the symptoms are much milder and could easily be mistaken for forgetfulness as one grows older, making the diagnosis of Alzheimer's a serious problem. Now, despite advances in healthcare and medicine over the past century, and especially since the beginning of the 21st century, Alzheimer's disease seems to be growing in prevalence, disproportionately affecting the elderly population. This can best be shown in these two graphics, where Alzheimer's disease has unfortunately grown in age adjusted death rates in almost every state. Globally, this is a large problem as well, with the WHO reporting that more than 55 million people were living with dementia in 2020, with over 60% of whom living in low and middle income nations, with Alzheimer's disease potentially contributing to 60 to even 70% of these cases. Deep learning can help reduce this problem as beta amyloid accumulation can potentially occur 20 years before the victim's first signs or symptoms of Alzheimer's disease appear. This means that early detection and treatment for Alzheimer's is key, as it can help slow the effects of Alzheimer's disease and increase the likelihood that the individual lives a long and healthy life. There are multiple methods to diagnose Alzheimer's using deep learning, including neuroimaging, symptom analysis, and memory testing. Each of these methods are unique and helpful, but cannot be used without strict supervision by qualified and experienced healthcare professionals. Deep learning can be used to help diagnose Alzheimer's disease with biomedical imaging using convolutional neural networks or CNNs, in which patient scans are used to train its network to recognize certain features that are in Alzheimer's disease. One obstacle is that it is difficult to train these deep learning models without access to patient scans, as they are considered protected health information under HIPAA, and most likely for good reason. A solution to this problem is that the CNN model can rely on public datasets like OASIS or ADNI. ADNI standing for Alzheimer's Disease Neuroimaging Initiative. However, accuracy rates may still be a concern as it may recognize incorrect features or assume features that are common with general brain disorders as features that are unique to Alzheimer's, which is why strict monitoring from healthcare professionals is still required. Similarly, we can train a recurrent neural network or RNN model to recognize certain symptoms prevalent in Alzheimer's and guide healthcare practitioners in a certain direction for diagnosis or treatment. An output could be a recommendation for further screening or an output indicating that the individual has Alzheimer's like symptoms. With this model, there are clear problems in obtaining a large enough data set for Alzheimer's disease, but data augmentation on a data set taken from volunteers can help mitigate this problem. Deep learning can also be used to diagnose Alzheimer's disease based on a dementia test, where you ask patients to complete a set of instructions or answer a set of questions. An audio input can be analyzed for certain features like slurring in speech, repetition in words, forgetting certain words, and struggling to coherently articulate speech. However, there are certain biases that the model may have, such as disproportionately categorizing people of different accents, people with functional speech disorders, or people who are not as fluent in English and may have it as a second language. So, what should you take away? Well, with 60 to even 70% of Alzheimer's disease cases coming from low and middle income regions, deep learning can help bridge the gap between patient or consumer and healthcare professionals, allowing areas that may be overburdened to rely on deep learning alternatives to speed up the process of diagnosis between patient and professional, which may mean more time to work on developing treatment plans or more patients that can get access to these healthcare professionals. Unfortunately, it also seems as though this problem is far from going away, with the CDC stating that in 2023, 6.7 million Americans were living with Alzheimer's disease, and this number is projected to triple by 2050. So it is up to us teens to do everything we can to at least provide everyone access to Alzheimer's care, because this disease affects not only its victims, but their families and friends. We should not get desensitized to this disease or any other diseases due to their prevalence, and aim to make lasting impacts in the sector of public health. Here are my references. Um, First, I would like to thank my family and friends who have supported me in my journey to even get to this point. I appreciate you all. I would also like to thank my friend Achut for helping me review this presentation and what I've discussed today. Finally, I would like to thank the team at the Global Health Leaders Conference for providing the youth an opportunity to show our voices and making meaningful impact. Thank you.